Firstly, Rana Rahal is going to speak. She's our keynote speaker. And Rana is a humanitarian expert from Lebanon and currently serves as head of Emergency and Refugees Department at Caritas Lebanon, a position she's held since 2015. Caritas Lebanon was set up in 1976 and coordinates a series of programs across the country to meet the needs of those living in poverty, including those fleeing the war in Syria. Rana holds a degree in clinical psychology and is also currently pursuing a master's in poverty reduction at the University of London's SOAS Institute.
Thank you for the introduction. So I will be talking more specifically about Caritas Lebanon's work regarding mostly the presence of the refugees in Lebanon. Lebanon has been known now for the great hospitality of hosting more than 1.8 million refugees in Lebanon. For a population of 5.9 now, which makes around 25% of the population, refugee population. Before the Syrian crisis started, Lebanon hosted a large number of Palestinian refugees from Palestinian, and also received Iraqis, Somalis, and Sudanese as well during the crisis in their country. The situation of the refugees in Lebanon is not quite easy for them. And also it's not easy for the Lebanese as well. We don't have, unfortunately, formal statistics. Neither the government has formal statistics on the number of refugees in Lebanon or where they are or how the economic situation of everyone. But the estimation of the humanitarian committee or the humanitarian or the international community in Lebanon is estimated through surveys that they conduct on a yearly basis that more than 73% of the displaced Syrian are living in residential buildings, of which 25% are deemed below minimum humanitarian standards. And also another estimation of around 250,000 living in informal settlements, of which 80% need weatherproofing assistance. And 33% of them are living in crowded shelter conditions. And unfortunately, only 6% are renting through written lease agreements. For the vulnerable Lebanese in Lebanon, the estimates are that more than 500,000 Lebanese are living under the poverty line. And that number rose also after the beginning of the Syrian crisis in Lebanon. And it is assumed also that 25% of them are living in substandard shelter conditions in residential buildings. Is Lebanon facing an urban crisis? Yes. Since now Lebanon is more than 87% urbanized, the percentage also of refugees living in urban environment is also very high. And since the beginning of the crisis, there was no clear cut or division between refugees and host communities. So refugees started to enter Lebanon and settle within the Lebanese communities. And increasingly, the refugees also as well are desiring to reside in bigger urban areas where they can also seek livelihood opportunities where it is also more accessible to them. And large number of tenants are evicted from their households. We receive lots of cases at risk of eviction due to either their economic situation, they cannot afford to pay the rent, or also in some cases of gentrification of some neighborhoods. As you are also probably aware that the government of Lebanon is not a signatory of the Convention of 1951. So anyone in the Lebanese territory that is seeking protection or is fleeing his country due to persecution or war is not considered as a refugee. He's considered as any other foreigner in Lebanon. And also in the beginning of the crisis, the government banned the formation of any formal tented settlements or any formal residential units for refugees. So the refugees had to resort to the, renting agricultural land and building their own tents. And of course, without the proper assistance, these shelters are becoming very, very, very weak. And they lack an adequate sanitation and proper waste collection. In addition, as you probably know as well, that the Palestinian camps in Lebanon, specifically in Beirut, they also substandard residential units, and they are informal as well. But also they have hosted Palestinian coming from Syria. So the estimation is also around 20,000 of the most vulnerable Palestinian refugees from Syria are also living in substandard shelters. And the Palestinian camps also hosting the Syrian refugees led to overcrowding of the residential units already existing. This is a picture of one of the houses that Caritas Lebanon is following up on the case, living in that. And this is just a sample. And usually the poor housing conditions of refugees in Lebanon, they are composed of basically one room and sometimes one bathroom. And the one room are shared between several families, several households, which is also becoming problematic. If you want to talk very briefly on the challenges that the humanitarian actors in Lebanon are facing, is that we have a trend of a displaced population downgrading their shelter types from residential units to non-residential units, as well as informal settlements. And we have been seeing also people that are leaving their houses to move to collective shelters or to unfinished construction sites, or as well to informal settlements in the Bekaa area, for example. Also, the socioeconomic situation in Lebanon is not getting any easier. A small country with already its own economic problems has hosted 1.8 million refugees. The infrastructure in Lebanon is not ready and was not ready to host that many people. So also the economic situation of the refugees are also deteriorating. And we are witnessing as well some increase in the average rent, and also the landlords are taking advantage of the situation, and of course they are increasing their rent. And facing the challenges that we have with the government not to help the refugees with any sustainable or permanent housing solutions for the refugees, we are faced with the situation of what to do for these refugees if we cannot help them have inadequate housing. And of course, these challenges or these conditions for the refugees as well as for the Lebanese are increasing their risks to protection and health. We have witnessed also an increased rate of gender-based violence, and as a result of overcrowdedness, lack of partitions for space separation, and absence of lockable doors. Specifically also in the refugee tented settlements in the Bekaa, where also lack of proper lighting as well is creating and increasing the risk of protection specifically for women and children. And we are receiving also a very high number of referrals of cases that are at risk of eviction due to their inability to pay the rent, and they are also facing the loss of livelihoods, and especially in Mount Lebanon and Tripoli. Not to mention also the social tensions that are rising between the host community, between the Lebanese community and the refugees. Some of the Lebanese would say, this is the 8th year of the crisis. For how long we are going to be able to carry on this load, this burden of having so many refugees in Lebanon that are starting also to witness that Lebanese are losing their jobs to Syrians, and they're not, and the Syrians are more and more involved in the informal sector. So Caritas Lebanon interventions in the shelter sector in specific, we have several interventions, and it's not limited to just one, because the context in Lebanon is very different, and it varies from one area to another and one region to another. And we also have always to take into consideration the social tensions that arise from in each area. So one of our most successful also intervention is the social housing. We have buildings or residential units for Caritas that we are renting out for vulnerable people below the market price. And there are certain selection criteria or vulnerability criteria for the households to be eligible to rent such houses. We provide also cash for rent based on vulnerability assessment and social assessments, and also cash for protection specifically for cases that are risk of eviction. And we also do mediation with the landlord, specifically also by our legal team. We also do some minor shelter rehabilitation. We're not a shelter expert, but as much as possible when we can, we provide minor rehabilitation work for the houses. And we also have operating 2 safe shelters to survivors of gender-based violence for women and their children. These are some of the minor rehabilitation work that we conduct that are mainly basically really minimal, but also they help improve the day-to-day lives of these vulnerable people. You can see that some of the houses lack either sanitation, minimum standards of sanitation, and this is where we try to address these issues on a more or less smaller scale. In our intervention, we seek always intersectoral linkages. So we always try to have a holistic or comprehensive approach. It's not just that we tackle the poverty or not we tackle just one specific issue. Our core intervention is based on the case management, on our social work, where the social worker will go outreach for the vulnerable families. They listen to them. They understand their situation, and we try to provide as much as possible a more holistic approach of protection services and gender, and taking into consideration as well their needs. In terms of protection interventions, this is one of our biggest sectors of intervention, where Caritas Lebanon provides life skill activities for refugees and Lebanese. And the life skills activities really help specifically more the women and provide them with more empowerment, because also the refugee context in Lebanon has changed the gender role within the Syrian family. So the Syrian women in Lebanon are becoming more in charge of the household with the absence of the father or the husband, or they're going back to Syria, or they've gone missing. So the women are found themselves facing this new challenge on how to deal with the household management and how to prioritize. So we provide them with life skills activities so they can really start taking in charge of their lives on a daily basis. Also, the cash for protection, as we mentioned, and psychosocial support. Also at the beginning of the crisis, we had lots of cases that suffer trauma from the war and what they witnessed as violence. And also it is continuing in Lebanon, because also even after they settled in Lebanon, the economic situation is not really easy for the refugees. So they resort to several negative coping mechanisms, and the violence and the domestic violence is rising in the household. So we provide psychosocial support and legal assistance as well, because as we mentioned, the refugees are not considered as refugees, so they have to have legal papers, they have to have legal permits, they have to have work permits in order for them to access the workforce. In addition to tackle specifically the socioeconomic needs in Lebanon within also the Lebanese and the refugees, we provide what we call is the basic assistance. And the basic assistance are just cash interventions that are offered through ATM cards that are accessible for refugees and for Lebanese as well. The multipurpose cash are provided through, as I said, ATM cards, and sometimes, yes, so I'm talking too fast, right? Okay, I tend to, sorry. All right. Okay. And we also provide in-kind assistance, such as food and non-food items, and specifically for emergency cases, and winterization, because lots of refugees are living also in cold areas, in mountain areas, where you have snow during the winter and it's very harsh winter conditions. We run also soup kitchens, where we provide daily meals for all population that knock on our door. They receive hot meals, and they have also the opportunity to take some additional portions back home. And recently, we have launched livelihood programs, which are designed to provide cash for work opportunities for both Lebanese and refugees as well. And since also for the refugees, they don't have really access, to formal workforce, so they are restricted to work under 3 sectors only, which is the construction, environment, and agriculture. And Caritas Lebanon, in order also not to, breach the legal status for the refugees or to put them in harm, so we're also restricting our livelihood opportunities in these 3 sectors where the refugees are entitled to work. I have chosen 2 case studies, or 2 cases that are followed by Caritas Lebanon. These stories are really just representative of what the refugee community is facing in Lebanon. We have lots of cases that really are heartbreaking, but also we can call success stories where Caritas Lebanon's intervention really helped these families to really rise above the poverty line, or to have more sustainable livelihoods over the time. Niveen family used to live in northern Syria, and the fight started. Her husband got killed in bombing, and this traumatic event made her run away from the country in search of a more secure environment to raise her son. So she arrived to Lebanon, and then she realized that her life is much harder than expected, and she wasn't able to provide for her family. She was homeless, living on the streets of Tripoli in the north of Lebanon, and desperately begging for help. And she has a 16-year-old son who has epilepsy, so it was really also hard for him to get a job and to help his mother. And Caritas Lebanon, through the case management, enrolled her in the emergency cash assistance, and she was able to rent a small house. And then we helped her also to find a job in a restaurant where she is helping with cleaning and basic kitchen tasks. And as she says, that they lived in a deserted car for quite some time, and they were exposed to all kinds of exploitation. And this is a scene of of a very familiar scene that you see in Lebanon, where you have children on the streets, whether they are accompanied or not accompanied with their mothers or not. But this is a scene that is becoming very, very familiar wherever you go in Lebanon. Amira, Niveen was a successful case. Amira is not so much of we're still working with her, and we're still trying to find her a solution. But Amira is in a very difficult situation, where she is a single mother of 4 children, aged between 5 years old and 7 months. Her husband left her, out of the blue, he decided to leave and went back to Syria, and she was pregnant with her last child. And she doesn't know anything about him. And Amira lived in a shared apartment with her sister, and she had to pay also, of course, $225, for which for a refugee is very, very high, and used to work to provide the basic needs of her children. But her sister, after a while, she just started to get a little bit frustrated because she had 9 children of her own, so she couldn't take care of her sister's children again. So, and also because of the housing condition, the children were always at risk of getting burned, electrocuted by shocks. So the sister decided, I won't take this responsibility. So Amira had to quit her job to stay with her children at home. So she can't now work, and she couldn't leave her children alone. And even though she was interested to work and to participate in the vocational trainings that we offer in our community centers. And Amira's psychological state is now deteriorating, and she is resorting to negative coping mechanisms, and she is now neglecting and beating her children. We are still working with her in order to make sure that they are, that the children are safe. But these are the kind of the cases that sometimes it's really, really difficult. And when you have the needs becoming very complex with time, so it puts us in a position to really rethink of what our intervention and what we really can do for these people. And thank you so much.